My guest today graduated from the University of Kentucky College of Medicine, worked as a doctor in the field of pulmonary and critical care. Recently, she has transitioned into lifestyle medicine and has received numerous certifications in both nutrition and health and wellness and coaching. I'm very excited to have her here today. Please welcome Dr. Malia Ray. Doctor, how are you?
Good. Thank you so much for having me.
Yeah, of course. So I always like to start off with letting our listeners get to know you a little bit more. So could you tell me maybe some background, how you got started in medicine and how you transitioned to lifestyle medicine? And yeah, just let us know all about you.
Perfect. So thanks. So as you brought up, I grew up in Kentucky, the northern part, just a suburb of Cincinnati, and did my medical school there, and then did some residency and fellowship training in Cincinnati.
Okay.
I always had a broad interest, so for me, it was actually hard to decide what field of medicine I wanted to go into. I decided on pulmonary critical care because it was one of the only rotations. We have these long call shifts. You go in at 7 one morning and you don't leave until like noon the next day. And when I was in the ICU, that was the only time that I kind of left after those shifts, but I was still in good spirits. I didn't feel totally beaten down.
Yeah.
Even though it can be hard, it also can be really rewarding as well. And so I decided to specialize in that. And so I did. And then when I was finished that training, I practiced for a few years in Cincinnati. And I was happy. It was tough, but I enjoyed it. I moved to Rochester in 2015 for my husband's position. Um, I had started to read more about nutrition on my own before the move because despite enjoying the job, I was on call every other week to every third week for 7 days in a row.
That's
So
difficult.
um, I wasn't able to take care of myself always as well as I wanted to. And so I was trying to find little things that I could do to improve my health, despite some of this lifestyle that really wasn't conducive to my health. So I kind of just started getting into nutrition and trying to at least make sure what I ate most of the time was good for me.
Yeah.
Um, so when I moved to Rochester, I did initially take a position in pulmonary critical care, and it didn't end up working out to be what I wanted it to be. So I left that a little short of a year into it. So then I found myself with a bunch of time on my hands. My identity for years had been being a physician. So
Yeah.
it was adjustment, like, who am I now? What do I do now? And so it took a few years. I continued learning about nutrition. And as you learn about nutrition, it takes you into kind of learning about metabolism and then takes you into kind of sleep and stress. And you end up, learning about all these other aspects because the body is so interconnected.
Mm-hmm.
You can't just really focus on one aspect. And then that kind of brought me to lifestyle medicine, which encompasses all those different areas. um, so I was doing all this learning. I had heard of a smaller clinic in town called the Rochester Clinic, and they were doing some stuff with lifestyle medicine, offering some educational programs. And so I offered to help out with some of those, just out of my passion of enjoying this and wanting to share it. So
Yeah.
I started to do some of those educational programs, but then realized education was great and it was enough to motivate some people, but not everybody. Some people took the information and ran with it, and some people it just really wasn't enough. And so I wanted to learn a little bit more about what I could do to help people make the transition into healthier lifestyles. And that's what led me to health and wellness coaching.
Okay.
Took that course in May of 2018. And I came home super excited. And that's when I told my husband, like, I'm going to start my business. Like, I just learned what medicine is missing because it taught me, like, in medicine, we're like, you need to lose weight. You need to stop smoking. Bye-bye, go do it. And I'll see you back in 3 months and see
Yeah.
how that,
Uh,
and it seems common sense, but like the coaching course, like, told me like why that didn't work. People
yeah.
need that to actually change their habits and behaviors. And so I felt like, wow, like I could really do this. Now I know I can tell people why they need to do this. And now I can also help them figure out how to do it. So that's when I decided the business. And then it took me a little while to figure out, do I want to, do I want to just be a coach? Do I want to do some, medicine in there with it? And I decided, that I went through all this training. I like being a doctor. So let's delve into it. And more complicated business wise, you need malpractice, all that stuff. But I just went ahead and did it and got my certification in lifestyle medicine and opened my own practice.
Wonderful. And you're right now, how's it going? You're enjoying it?
I am. Yeah, it took being a physician is something I'm comfortable in. Being a business owner is something I'm not. So that aspect has taken a lot of growth and a lot of like getting comfortable with it. But yes, I'm having a lot of fun.
Okay, great. I guess maybe our listeners aren't sure, and even I'm not. How would you define lifestyle medicine, or what is lifestyle medicine?
Lifestyle medicine, it has some different pillars. So the pillars are nutrition and sleep and stress management. And having like a support network, having a passion, kind of dealing with addictions, and then physical activity as well. Those are kind of the pillars. And so basically, it's kind of taken the evidence and the research on all these different topics and, kind of compiles them to help people make the changes, because we know that so many chronic diseases are a manifestation of things going awry with these lifestyle factors. So it's helping people to use this evidence, incorporate it into their life to overcome chronic diseases, chronic symptoms, improve their quality of life. And it does address also a lot of the behavioral change aspect, so that we're actually helping people make those changes as opposed to just telling them what to do.
Yeah. Was it difficult transitioning from Western medicine to lifestyle medicine? Did you find that hard to kind of, I guess, not be so direct and following the charts and being more open and just listening and trying to find out what's deeper going on? Was that difficult?
Was like I've always been a real relational person. Like I love relationships. That's one reason I loved medicine, was just seeing people back and not only checking in on their health problems, but just seeing what's new in their life. And so that part, like my right now, my appointments are much longer. Like my initial consultation is usually at least 90 minutes. So I really get to know people. I love that part. That part wasn't difficult for me, but it is sometimes difficult to, I think, a couple of things, to not want to just give somebody a medicine. Like I sometimes have to catch myself. Like I know I utilize all the lifestyle aspects, but then some part of me wants to be like, here, take this medicine too,
Yeah.
And I know that the person, they can make the changes. I just need to. It takes time, right? We all need patience, and medicine. We've become more of like, take this medicine, it'll fix it right away, and we don't wait for the lifestyle change as much. So that has been a little bit of an adjustment, I think. And then just also, when you're doing lifestyle medicine, I can give people advice and recommendations and help them, coach them along. But ultimately, the ball is in their court. Like they have to want to change, and they have to be willing to take small steps to change. And so that's hard too, because not everybody is ready for that. And so I have to realize I'm not in control. That they're in control. I kind of have to detach myself from the outcome.
Yeah. I see that, like the medicine side and the coaching side being so harmonious together. Like for me, it's a no brainer. I'm like, yeah, I would want my doctor to be a coach. Like I want them to be, be on my bench and being like, you got this, Jordan. You just got to do this, this, and this, and guide me to do that. And that's missing right now in most of Western medicine. It really is a big aspect that, to me, like I said, it's a no brainer. It's a wonderful idea that I'm sure that's you're not the only one who has. There's probably multiple people doing it, but you're definitely one of the only ones in the area of Rochester that is doing it.
Yes, yeah. I think out west they've embraced the health coaching a little bit more, and I do know actually, not in Rochester, but quite a few physicians outside that have gone back and done coaching. So I think it is definitely gaining in popularity. But you're right; it's just still in certain regions not as embraced.
Yeah. To give the listeners and viewers a little background, so you're in Rochester, Minnesota, and Rochester, Minnesota has the Mayo Clinic, and the Mayo Clinic is one of the biggest hospitals. They're one of the most reputable. They have a great reputation of having a specialist for anything that you can think of. They have it. I was looking up a statistic right before we jumped on the call, and they employ like over 50,000 people, not just in Rochester, but they have a network. And then like what was it, 1.2 million like visitors came to the hospital last year, like for different illnesses. So they're huge. So what is it like working in an area that's so dominated by Western medicine? Are you seeing some patients that just can't figure out what's wrong with them with the Western medicine, and then they come to you to try to solve it?
Yes. So, yeah, I think in some ways it's a blessing, some ways it's a curse. I think what I'm doing is unique. And also, because I have a small practice where I don't have a lot of overhead, I'm able to have those long appointments with patients where they're really able to tell me. And that's what I hear most is that people are shocked by the fact that I'm with them for longer than 15 minutes.
Yeah.
I think that is how what I'm doing is definitely different than kind of the conventional medicine. And
Hmm.
people that they really want to be heard. And I think, especially when you're trying to figure out a way to do it without medicine, like you really need to hear their story and figure out when it started, and kind of the whole path of the illness. So I think, and that way, it's a bonus that my style is so different than conventional medicine. So I do attract people who want to kind of get a little bit more to the root cause of what caused their condition or symptoms in the first place, and not just take a medicine to.
Yeah.
I think from a business perspective, it's a little bit harder. Like you could probably start a business in any decent sized town and you have like a Quest lab and a lab core, and you can, make relationships, with some other medical businesses. Here in town, if I want to order labs, I have to use OMC or Mayo, and they're great. They let me fax the orders and stuff. But I think in some respects that way it's limited because I don't have any outside resources really that I can use.
Yeah, I didn't even think about that. They probably just dominate that whole side of it in town. They
Yeah,
really.
and think about it. I was getting my electronic medical record set up, and they were like, "Oh, do you want to like sync with Quest or LabCorp?" And like, then I Googled, and I was like, "Wait, there is no Quest or LabCorp in Rochester." Like I guess not.
Yeah, and Rochester, the population is like around 110,000 people. So the majority of the community works at Mayo and the surrounding areas as well. Everybody commutes there, so it's really heavy. So I love the fact that you opened up in Rochester and you are like, "Hey, I'm gonna do this," and you weren't afraid of maybe the pushback that you saw, or maybe you're still seeing, or probably will see in the future. Um, but that's such a I personally respect that so much.
Thank you. Yeah, thanks.
Yeah. So I guess maybe walk me through like what would it be like if I got an appointment with you and I had something going on and I just needed to come in for an assessment? Like how would that go? What would it look like?
So before the appointment, you would get some intake forms. Kind of one is just the traditional, like, what do you want help with? Tell me a little bit about your history. It does hit a little bit on some of the lifestyle medicine aspects on the bottom. And then one that kind of lists some symptoms and, assess the symptoms just so I have a little bit of better idea of what you have going on. And then in the actual visit, like I said, it's usually longer, 90 minutes, sometimes 2 hours. There's a lot going on.
Hmm.
Um, we'll cover the initial concern, kind of the history of what's been going on with dad, and then I will really delve into all the different pillars that we talked about. So a lot into nutrition, what's a typical breakfast, lunch, dinner, and caffeine, and kind of some of the different nutrients that I feel like most people should have in their diet. And then we'll touch on what physical activity they like to do, what they are doing, what are the obstacles preventing them from doing it. Sleep, kind of the same thing. And we will go into sources of stress, coping mechanisms for stress that they're using, support, purpose, and then hit on any addictions that they may or may not have. we'll do kind of the typical medical visit sort of thing with blood pressure and vital signs and an exam.
Yeah.
And then what I've been doing most often, so then if I feel like more evaluation needs to be done, I'll order the labs or whatever at that point. And either way, I've usually been breaking the initial consultation into 2 visits, because after 90 minutes or a little bit longer, I think both my and the client's head are a little bit full of just kind of, covering all that stuff.
Yeah.
Helpful to come back with a second visit, and gives me the time to kind of go back again over their history and kind of just figure out everything that is probably contributing and going on. And then in the second visit, we'll talk about recommendations and how I think that those recommendations would benefit them, kind of actually what's going on, and how would that affect it. And I do a little bit of coaching within there too. So most often after the first visit, kind of at the end, I'll ask the client to pick maybe like 1 or 2 small action steps that they could take to improve upon something that we talked about, whether that be a little bit something to improve their nutrition or just a little bit of movement or something. And then that allows me to kind of follow up with that on the next visit, and see how it went, what were the obstacles. So they get a little bit of an idea of what coaching is about, and how that could, help them in their journey of behavior change.
Great. That just that you what differentiates you automatically that I see from, conventional medicine is that you have like almost your initial consultation is 2 appointments where, normally I would just like if I had something wrong with me, I'd go to the doctor and they'd be like, this is what's wrong with you. Here are some pills. Have a good day. Call me if it doesn't go away. And at that point, likely whatever they gave me probably numbed me to what I was feeling, and I didn't actually resolve the issue at all. So I really, really like that you kind of split it up into 2 and process it that way to really get to know your patient. That's so key.
Yeah.
Yeah. So I guess the next question I had written down here is COVID related. Yeah. So like given your pulmonary care like background, and now that the COVID numbers are spiking again, like, do you have any recommendations like on behaviors or even alternate treatments that could help our listeners either like one recover faster or prevent from getting it?
So I think anything that helps to boost the immune system, just get you baseline healthy. And so for that, definitely like good nutrition. There have been a decent amount of studies that have shown that vitamin D can be beneficial. That people who have vitamin D in the higher ranges tend to fare a little bit better when they get COVID. And in Minnesota this time of year, we're not getting a lot of vitamin D because it's
Yeah.
like hormone, right? So I do think just in general, most people should supplement with vitamin D in the wintertime if they live in a place like Minnesota where you're not getting the sunshine. And then, yeah, just paying attention to what you're putting in your body food wise and trying to make that as nutritious, filled with phytonutrients and antioxidants. So you're really bolstering your immune system. Your gut is also super important for your immune system, and so nothing makes the gut happier than fiber, because then you're feeding the little bacteria, the microbiome that live in your gut, with the fiber, and they help to support our immune system as well. So I'm a big advocate of a lot of fiber in our diet.
I'm doing both of those things. I literally took a vitamin D last night, and every morning I have a protein shake it's either hemp based protein or like chickpea protein. It's not whey or soy or like dairy based protein. It's plant based protein.
Yep,
Um,
sounds perfect.
not quite a vegan or vegetarian, but very close. Very
Cool.
close. Yeah. Um, let's see what the next question I had written down here. Oh, the one that's also like always one of my favorite ones to ask is now that you've started your own practice, or even if maybe you've seen it before you started your own practice, like what is one specific healing that you've seen happen, like a successful healing that you've seen done with the alternate medicine, with lifestyle medicine? Can you think of one that really sticks out? It's like they just had this miraculous change.
Yeah, I do have. So there was one gal who had type 2 diabetes, and we measure the control of type 2 diabetes, like whether you're well controlled or not, by a number called hemoglobin A1C. And so if you have your hemoglobin A1C above 6.5, you're considered type 2 diabetic. And most people who have it, a conventional physician will kind of shoot for keeping the hemoglobin A1C below 7. And so this gal had had diabetes for years. Her hemoglobin A1C was 13 and some change, so super high.
Wow.
And we all know that insulin resistance is the underlying cause for so many things. It's been shown to probably contribute to Alzheimer's and so many like metabolic problems, vascular disease. So it's probably one of the number one things that people should try to combat is insulin resistance. So this was somebody who went through one of the educational programs that I was helping the Rochester Clinic with. And so she was learning more about nutrition and really just made some small tweaks. Like if she went out to dinner to a pizza place, she would order the special whole wheat crust and a veggie pizza, and she just tried to be mindful. She didn't totally give up everything that she enjoyed, but she just tried to make better choices, would snack on some fruit, and then just added a little bit of physical activity. Nothing that was even, not hours in the gym or anything, like a little bit of walk here or there, a hop on the treadmill on her lunch break. And within like 6 or 7 weeks, that was enough to bring her hemoglobin A1C all the way down from 13 and some change to 8, which was
Wow.
amazing
Yeah.
progress in that short amount of time. And even though, she hadn't lost weight or anything at that point, just having that change was enough to probably really cause quite a bit of healing within her body.
I've read stories about people like not curing their diabetes, but really reversing it after they've done diet change, and
Yes.
that it's just done miraculous things for people. And it seems so simple, it's just like, oh, if I just am conscious about eating what, or putting what I put in my body, I'll change some things. But not everybody thinks like that, and they just think, that they're stuck like that. And
Right.
what are like, so other than like diabetics, what are some other illnesses that you see often come to your practice?
I've actually seen a good variety. So yeah, diabetes and prediabetes is a big one. Hypertension, high cholesterol are all things that can really get better. Obviously, people who want to lose weight, seen a lot of that. I've seen some like mood disorders and some depression, which also can get better with lifestyle change. Probably one of the big ones is ladies as we hit our 40s and 50s and we're going through hormonal changes.
Hmm.
Um, can result in a lot of things going on. So I would say actually probably my biggest population so far have been females in that age range, just trying to deal with the hormonal shifts that they have going on,
Yeah.
and then a lot of lifestyle adjustments to make that transition easier as well.
Yeah, I've read that the hormonal changes really can affect everything, especially sleep. Like that, it's
Yeah, yeah. And if you don't sleep, you don't feel well at all.
right, and then that could just is a snowball effect into all
Yeah,
these different illnesses. What
things and
are
weight and right.
what are your like? I guess if you could give some tricks to maybe somebody who's out there, maybe a listener who's like, going through hormonal changes, what are your recommendations for them to get better sleep?
So I think it all depends kind of on like where they are in the cycle. There are some, different supplements that can help. So magnesium can help with sleep. There are some different supplements just in general that can help with the hormonal change. And it kind of depends. So some people will it's just the hormones themselves. Stress hormones and sex hormones are very tightly kind of interrelated together. So
Hmm.
sometimes if somebody is really stressed out or if they have thyroid problems, those can affect the sex hormones. So sometimes it means going back and fixing those two things to help with the sex hormones first. But so yeah, it's one of those things. Probably one therapy doesn't help everybody. It kind of depends on exactly what is kind of the underlying issue.
Yeah. I guess maybe I say I would assume, but I feel a lot of things are caused by stress. Like, that stress is like number one. Is that true? Do you?
Stress is huge, and I think that we in medicine don't appreciate it as much as we should. But yes, stress can muck with everything. You can muck with your thyroid, your sex hormones, your metabolism, all those things. Almost, I feel like almost any problem could have some underlying issue and stress if that's a problem for you.
Yeah, and stress can come in so many ways too. It's not just like, that you are stressed at your job. Like it could even be like on your way to your job, you got, in traffic and you're like, oh, this traffic, and just I feel like catching yourself in that moment and making that conscious decision to not let it bother you can improve your health so much.
Yeah, you are definitely right.
Oh wow. So, what are some really simple changes that our listeners or viewers can do like today or tomorrow that would considerably improve their health?
See, the biggest one, which I mentioned earlier, is fiber. So just
Fiber.
really the fiber intake. And fiber is found only in plant food. So anything, fruits, vegetables, whole grains, nuts, and seeds, just adding a little bit of that to the diet is going to do wonders. And then I would say just any sort of movement that people enjoy. It doesn't have to be 30 minutes on the treadmill if you hate it. It can be taking a break from work, especially now since so many people are working from home, taking 10 minutes, dancing to your favorite song, taking the dog for a quick walk, any sort of little movements, breaking up the periods of us sitting. So a lot of people have heard the saying, sitting is the new smoking. We know now that a lot of studies show if you just sit for 8 hours a day, that it can cause you a ton of health problems. So trying to break up those periods for 1 or 2 minutes.
I've never heard that saying before, that sitting is the new smoking, and it makes a lot of sense because just recently I've been really working a lot more on my computer. And
Yeah.
before, for literally my whole entire life, I've always had jobs and stuff that has involved me being on my feet most of the day. And I've noticed like now I'm getting back pain, and it's probably because I'm sitting down too much. So that's really interesting. And then fiber, yeah, I think luckily I taken enough there, but that's probably something a lot of people underutilize is getting enough fiber into their system. And yeah, movement. I love that you said, put on a song and dance. Like that's a great way to enjoy movement. Everybody loves dancing. You don't have to.
When I ask people what's your preferred, movement, I've gotten a couple people that say dancing, and I love it. Go out and do it then, like
Yeah.
why not?
Yeah, or well, right now we can't go out and do it because everything's closed, but put your headphones on and get
Yeah.
groovy in your own house.
Yep.
Yeah. So a question that I thought of right before the interview is, if there was like one therapy or practice that you wish Western medicine would integrate into the practice right now, what do you wish that would be?
So for me, it goes back to stress, as stress being such an impact on our health. So for me, it would be a breathing practice. There's a lot of literature to support breathing um, and helping stress. And not just any breathing. So what I mean by that is doing slow, deep breathing on
Hmm.
average 6 breaths a minute, where you're inhaling, say, inhaling to a count of 4, exhaling to a count of 6, or something similar where the exhalation phase is a little bit longer, and doing that for a minute or two. And so, what that does is during that slow, long exhale, we trigger what's called our parasympathetic nervous system, or kind of our relaxation system. And I have some pretty cool technology in the office where I can put a little probe on people's earlobes and have them do this, and it will monitor their heart rhythm and rate, and you can actually see the fluctuation in it when people switch over from just breathing at baseline to doing these slow, deep breathings, and you get in this really nice kind of rhythmic heart pattern. And if you think about it, it makes sense because we all go back to like running from the tiger, like that's how we evolved, right?
Hmm.
Tiger. And if you're doing slow, deep breathing, you're telling your body, I'm not running from the tiger, like, because you can't run, you can't be panicked and doing slow, deep breathing at the same time. So it's
Right.
a way to tell your body, like, it's okay, like, let's relax, let's chill out. And that can kind of break that stress response. And so I always like people to practice it, like, at a set time, like morning, evening, whatever works for them. And then the goal is then to start utilizing it, like you talked about, when you're sitting in traffic and you're like just feeling yourself boil with like anger and impatience, to then kind of where you think, okay, I'm going to start doing my deep breathing now, like it's okay. And it kind of attenuates that response. So it sounds ridiculous, but like such a small thing, but I'm like, I think the world would be like a different place if we all did that. And actually the military has started to embrace it too. I listened to this
Really?
from a Navy SEALs guy, and he said their motto is, how can you expect to control your psychology if you can't control your physiology? And they control their physiology by doing this breathing sort of stuff in the Navy SEALs.
My sister graduated from the Naval Academy. I'm going to ask her this question now that when I get out the, when I get this, but it's so simple breathing. So it makes me think of mindfulness, mindfulness meditation, just being aware of your breath. That is like the first thing they teach when you start learning about mindfulness meditation. It's just everything about breath. When I breathe in, I know that I'm breathing. When I breathe out, I know that I'm breathing, and just trying to maintain that thought only in your head. And it does relax you. Actually, yesterday I had another interview with someone who teaches mindfulness meditation, and he had me do the practice while we were doing, and he had me just put my hand on my heart and take deep breaths. And he's like, so, after a few minutes, he's like, how do you feel? And I was like, immediately relaxed, immediately. And that's not going to cost Western. That's not going to cost the doctor anything. You can prescribe breathing left and right.
You know, yeah.
That's
Even
just
2 minutes would even be beneficial. Yeah.
wow, just such a simple thing. I love that answer. That's a great, great answer. Wow, that's something that's going to resonate with me for a while now, and I'm sure our listeners are probably already taking deep breaths, just thinking about like, am I thinking? Being conscious about your breath is everything. We're conscious about what we eat, what we drink, and we can go 3 weeks or so without food, and a few days without water, but you can't go longer than a couple of minutes without breathing.
Right. Yep. Yep.
Uh, there's a simple thing to change your health. Anybody who's watching and listening,
You don't need to buy anything special. It's free. Like, yep. We all have 2 minutes in our day. We could do that.
well, I'm gonna just like leave it there. That's like the perfect ending. It was a doctor. It was really a pleasure having you today. I appreciate your time. Thank you so much for joining us and giving your advice. If there's a way for people to get a hold of you, how do they do that? What's your website, your email, or phone number? If you want to give out that, let me know. And then I'll also take all this and put it in the show notes so people can find you there as well.
So the website, my business is called Radiant Wellness, and that's spelled RAYDIANT Wellness. I am on Facebook and Instagram. Instagram is Radiant Wellness. Facebook is Radiant Wellness 2. And people can shoot me an email if they want at malia@radiantwellness.com.
Perfect. Well, Dr. Malia Ray, I appreciate your time so much. And if you guys want anything at all to find out about just lifestyle medicine, you have the contact now. She's right here. So reach out to her. I'm sure she'd be happy to help you.
Definitely. Thanks so much for having me. I really enjoyed it.
You're wonderful. Have a great day.
Yeah, thank you. You too.
Bye bye.
Bye bye.